torno a presentare la
Well, let me introduce Dr. Aude Veret, who's director of the school, the Naturopathic School, who will talk about the role of environmental pathology in naturopath education. Thank you. Thank you. Good morning, ladies and gentlemen. I'm very pleased to be here. I'd like to thank Salos for this invitation.
pour que ce soit plus
I'll do it in French to make sure it's more fluid. So, I am a director of one of the oldest naturopathy schools in France, founded by Daniel Keffer. He's 32 years old. Daniel Keffer, I believe, has already spoken in Parliament. So in 32 years, you can imagine that we've reviewed our training program quite a few times. So I wanted to talk to you about that today. Today, the training program responds to the best quality standards that exist. We've achieved the Calliope label in France, which means that all of our courses need to be thoroughly sourced, clear bibliography, and we need to make sure that continuing professional development is followed by all of our teachers. And we're quite a way forward from where we started 32 years ago. The pedagogical committee reviews our course to make sure that we can continue to train naturopaths as we continue to evolve. The pathologies we're looking at today are very much part of our teaching priorities. The link between health, the individual, and the environment is obviously not new. It's very much at the heart of our discipline, has always been from the beginning. If you allow me to quote Hippocrates, who said that in order to deeply understand medicine, you need to know the seasons, the water, the winds and the sun, and the way which individuals live. Now that was 400 years BCE. So, as I said, that was 400 years before Jesus Christ. I'm constantly surprised that we're asked to scientifically prove principles that have clearly stood up to tests for over 2,000 years. But I'm not against scientific support. It's impossible then to ignore the role of the environment in respiratory pathologies, cancer, allergies, and other issues we've already heard about today. In 2004, if I can get to the right slide. In 2004, ATTAC, which is a cancer research foundation, alerted listeners at a UNESCO seminar that environmental degradation was leading to new diseases and proliferation of old diseases, and that led to a call from various health groups asking for recognition and action. This slide comes from 2018. Céline Tiffon from the French Cancer Institute produced it, and it shows the link between the environment and the arising of pathologies, including its cross-generational nature, meaning that our lifestyle today will obviously have an impact on our health, but also the health of our children, and you can understand how problematic that is. It showed that saturated fats, processed food, lack of vegetables led to increased blood pressure, diabetes, obesity, and cancer, but also had an impact on the development of the brain, cognition, and behavior. So it just goes to show that you are what you eat. it also showed that pollution and other environmental factors had the same effect. These environmental factors can easily be listed. The Fondation de France, which is an institution that provides support for various projects, so helped here. The list of negative factors included water. I would like to add electromagnetic radiation, which isn't on that list at the moment, but which clearly is a factor today. Research on electromagnetic radiation and the mobile telephone waves shows that there is a link between the time of exposure to mobile telephones and stress being produced in the brain. So there is a real risk of a real increased risk of brain cancer from exposure to mobile telephones. There are a certain number of studies that have been carried out, that are being carried out on the impact of electromagnetic radiation. But since 2011, radio waves has been classed as potentially carcinogenic for a specific kind of brain cancer. And in 2012, the American Academy of Pediatrics, which is an association which had 60,000 healthcare professionals for children and adolescents, officially requested a study into mobile devices radiation. So their complaint was that the existing standards didn't reflect the research. And there's concern about electrohypersensitivity, which is an emerging pathology. And this is, if you look at this slide, shows that there is similarity between the various emerging pathologies. They're very complex. They can take many different forms and therefore require ongoing, thorough research before we can be sure that we're safe. We've also seen that people who are hypersensitive to electromagnetic phenomena is increasing as we go through time. And in 2006, a request was made by leaders in this field for further research into electrohypersensitivity. Now, obviously, this has an impact on what we are teaching. In our second cycle, we welcomed Professor Belbom, who wrote a book, which I strongly recommend, the Black Book on Waves and Radiation, which teaches the principles around electrohypersensitivity, enabling naturopaths to be able to effectively treat this phenomenon by participating in the studies of this phenomenon and also supporting prevention. There are a number of criteria involved in identifying cases. In each of them, the naturopath has a role to play in prevention, by investigating the lifestyle, which is very much at the core of our activities, or by eliminating the sources of these problems, or by knowing how to alert relevant doctors to the situation that exists. So we definitely have our role to play, and we can participate in research, the most effective of which is clinical research, which we can obviously participate in. So that is the example of the research questionnaire that was been produced for doctors and which is being reworked for naturopaths. Beyond electrohypersensitivity, EHS, what's important for us is to recognize that we put the well-being of the client at the center of our work, and that would be enhanced by cooperation between doctors and naturopaths. And that is the approach that we take. We build all of our modules with a first day where a doctor comes and talks about the cutting edge technology in their particular sphere, and we're very much encouraged by the warm reception that idea gets amongst the medical professionals. We also make sure that there's a lot of reading which covers both the areas of prevention and support. So today, our model is one of cooperation. Healthcare professionals responsible for research and care of their patients, and naturopaths working to prevent risks and provide support through a healthy lifestyle and living context of each individual. Thank you for listening.